Hello. Today we'll be discussing a topic which is very, very important and very commonly asked in the UCML exams. So this is related to shock, the types of shock, and the comparison of different types of shocks, especially the cardiogenic shock. So first of all, I will show you a small MCQ so we can appreciate how the patient looks like in this condition. So you can see here, this is a guy who is 68-year-old and he comes through the emergency. For what? He's having a chest pain, and the peripheral extremities you can see here are cold and clammy. The pressure is low. The heart rate is high, right? So pressure low and heart rate high means something. I will tell you later on. The JVP is elevated. Now the lungs show what? Bilateral crackles. Means what? There is fluid here. There is water there, right? So cardiac health shows here the reduced cardiac output, right? So heart's cardiac output is reduced, the pressure is low, the rate is higher, there is chest pain, right? So what are the hemodynamic changes which would be appropriate in this condition, right? So this is A, B, C, D. So I'll give you a small bit of time here to think, okay? So just a few seconds, right? Just think for the answer and then I will explain here. So the answer is actually D. Why D? We'll discuss these conditions. So the first thing here is he's having a severe substernal chest pain. So what's the meaning of that? He might be suffering from something related to the chest. In the chest, there are two things, the heart and the lungs, basically, right? Very, very broadly. So, and what else? The extremities are cool and clammy. That means, what is the meaning of that? There's vasoconstriction, right? Peripheral vasoconstriction. And that's the meaning of these cool and clammy extremities, right? So something is wrong here in the chest, which is actually the heart, because he's not pumping out and the pressure is low. And this 120 per minute is due to a reflex increase in the heart rate, right? A reflex increase. What else? The pulmonary congestion is there. So you can see here the cardiac output is low. There is severe systemic vascular constriction right here. And this is the pulmonary capillary wedge pressure, which you can see here. It is high here. So the cardiac output is low, systemic vascular resistance is high, and pulmonary capillary wedge pressure is high. So we discuss one by one different types of shocks and how you can differentiate between this type of shock and the other types of shock. So first of all, let's briefly discuss the cardiogenic shock. Now the cardiogenic shock, you can see here, this is the heart right here, which is a pump, right? Basically, it is a pump. So when the pump is failing due to anything, for example, myocardial infarction, the most common cause. So let's say the pump is not working. So what happens? The blood is not going forward. So the body will react accordingly. How? Well, the body starts reacting with the vasoconstriction. So this is the vasoconstriction you see here, and that's the reason the patient always feels cold and clammy, right? That means shock also. Any kind of shock, right? Most type of shocks, not every kind of shock, but most kind of shocks, you see cold, clammy skin. So this is the sympathetic overactivity. And that's the reason you also see the heart, which is beating faster. Now, what else? The heart is not pumping. So this was the left side of the heart. The right side of the heart is also not pumping. So what happens? The venous blood, which is reaching there, is not going forward, right? Because why? Because the right side is not working also. So the blood is congested backward in the lungs and then in the venous system also. So the lungs also get congested. The patient starts feeling breathlessness, right? Similarly, elevated JVP. So you see the pulmonary clackles also. So the classic triad of the cardiogenic shock, you can see here, starts with pulmonary the hypotension, right? And vasoconstriction, chlorplasmin skin, pulmonary edema, and elevated GVP, right? This is very, very typical. Now let's see a few things what could be the most important cause of this we have just discussed, which is the myocardial infarction. Probably a massive myocardial infarction. Not in every myocardial infarction the patient starts going into the cardiogenic shock, but of course if there's a massive the pump, maybe the LAD is blocked, the left anterior descending artery, a massive block might lead to the cardiogenic shock. The other examples could be there's something from the outside. So there's something from the outside. What's the meaning of that? Tamponade, right? The heart is being pressed like this, right? So that also can lead to the cardiogenic shock. Arrhythmias. Why arrhythmias? Well, arrhythmia means the heart is not pumping very well. For example, the most important cause in arrhythmia and can be emergency, and rather is an emergency, is ventricular arrhythmias, right? Maybe the severe ventricular tachycardia, right? Very, very severe. Okay, there are other causes also, like tamponade we have already discussed. There could be pulmonary embolism, but these are the major causes. Now let's discuss this same question and how to differentiate between other types of shocks. I will explain to you very, very briefly the other types of shocks here. So first of all, let's discuss this first one, which we have already discussed. Okay, what type of shock this could be. So here you see the cardiac output, which is low, right? And systemic vascular resistance, which is low, and pulmonary capillary wedge pressure, which is also low. So I'll give you a pause and let you think what could be the condition in which this type of shock you see here, right? Cardiac output is low. There is no reflex constriction, okay? Peripheral constriction. So they are dilated, right? Pulmonary capillary wedge pressure, not high, right? So everything is dilated. The reflexes are not working, right? The pump is not working. So what could be the cause, right? So the cause here in cardiac output is also low, right? Let's say if I say for the sake of argument, right? No, this is what cardiogenic shock. Why it couldn't be cardiogenic shock, right? Because cardiac output low. So I should say, okay, this could be the cardiogenic shock. Why not? The reason is here. The systemic vascular resistance. Remember in cardiogenic shock, the systemic vascular resistance was high, this is low, right? So this is typical of what? Neurogenic shock. Why neurogenic shock? What happens in neurogenic shock? Well, neurogenic shock is a sudden loss of the tone. Why loss of tone? And mostly the vascular tone, the venous tone, right? Suppose somebody have a very bad news, he falls down, right? And we say in a common language, well, he got a shock, right? The spinal cord is cut, right? The vessels are not getting these signals for constriction, so he goes into the shock, right? So this is a neurogenic shock in which the cardiac output is low and everything is low because there are simply no signals there. The vessels are dilated, everything is dilated, and the blood is pooled there. There's nothing like hypervolemic. This is not hypervolemic. The blood is there, but the vessels are dilated, right? Okay, let's do the next one. This one. Here the cardiac output is high, the resistance is low, and the PCWP is also low. So I'll give you a pause, right? And let you think, what type of shock is this? Here the cardiac output is high. That's the only difference. Otherwise, these are the same, right? Here the cardiac output is high. That means the pump is okay, right? Pump is working. But why these guys are not working? Why these guys are not working, right? PCW is also low. The systemic venous resistance or systemic vascular resistance is also low. This is very, very typical of what? Septic shock. What happens in septic shock? Septic means, well, there is some toxins, septic-like toxins, which is actually leading to the shock. Usually these type of shocks are due to the gram-negative septicemia, right? I mean, different types of bugs which can lead to the the lipopolysaccharides or different type of sort of materials which are coming in the blood, which is leading to the vascular dilatation. Usually what happens is the lipopolysaccharides, they initiate a sort of a reaction, ultimately which leads to the nitric oxide. Nitric oxide, this is a smooth muscle relaxant. So the smooth muscles are relaxed in the vessels also, in the endothelium also, they are relaxed, right? So that leads to the lower systemic vascular resistance, and so the blood is not going back, right? The heart is working, the heart is pumping. So what do you think this patient, if you touch his hand, right? How would you feel the hand? Would you feel it cold and clammy? No. This guy has high temperature, warm extremities, right? This is the basic difference here. This is a septic shock here. You see the cardiac output increase, all the other things are decrease. Let's go to the next one. The cardiac output is decreased, right? And the systemic vascular resistance is increased and PCWP is decreased. Okay, so I'll give you again a few seconds to think about it. What kind of shock is this one, right? This is increased. That means the nerves are working. Everything is working. There is no vasodilatation. There is no nerves problem. But PCWP looks something like this one. Okay, PCW is decreased. So what kind of shock is this one in which the heart is okay? The peripheral resistance is constriction. You see the cold clammy skin, but PCWP is low. Okay, that means what? Pump is okay. Peripheral resistance is okay. PCWP low means the blood is not enough. Blood is not enough to go back, right? And accumulate in the lungs. So body is trying hard, right, to compensate. So this is the hypovolemic shock. There's blood loss, right? And those sort of things. Okay, now the last one we have already done. So that was a very simple differentiation of the different things.